Hi, my name is Hannah Mahoney, and my team members are Ashley Castano and Michael Penny, and we're on Team 13. We're going to be discussing retail clinics, such as walk-in clinics and urgent care facilities. In our current society, walk-in clinics seem to be popping up everywhere. They're becoming so popular because wait times are shorter, you don't need to schedule an appointment, and basic medical services are provided at lower costs. If you've never been to a walk-in clinic or urgent care, let me start by telling you a little bit about what they are. Walk-in clinics can be located in retail stores, such as the CVS Minute Clinic. They also can be freestanding or in chains, such as the CareSpot Urgent Cares here in Gainesville. These facilities often have extended hours, laboratory testing available, as well as x-ray machines. The map above shows the distribution of the number of walk-in clinics per state from 2016. As you can see, the greatest number of walk-in clinics stand in the South. Surveys found that 29% of the population live within a 10-minute drive to a walk-in clinic. It is important that they are so accessible given many people in rural areas may be far from a hospital.
So, what kind of services do the walk-in clinics or urgent care centers provide? Also, who works at urgent cares or walk-in clinics? Urgent care centers and walk-in clinics provide care during business hours, typically 9 to 5, and are not typically 24-hour facilities. Urgent care centers, also known as UCCs, treat conditions that are similar to that of primary care practices and retail clinics. These include ear infections, strep throat, and the flu, as well as minor injuries like lacerations and simple fractures. Unlike emergency departments, UCCs are usually not equipped to deal with trauma, provide resuscitation, or admit patients to a hospital. These services are more geared towards emergency department services. Just like in the picture above, UCCs are staffed by physicians who are trained in a background about primary care or emergency medicine. Some UCCs or walk-in facilities can include nurse practitioners or physician assistants who work under the physician supervisor.
At retail clinics, the costs of the various services is much less than in the emergency room. For example, the most common thing that is diagnosed at emergency rooms and urgent care centers is upper respiratory infections. At the emergency room, the average price of this diagnosis is $1,351, compared to urgent care where the average price is $165. Some more examples of the cost differences to really put this into perspective is that abdominal pain can be diagnosed for $2,875 in hospitals versus $173 in urgent care. Allergic reactions, $1,139 in hospitals versus $159 in urgent care. Superficial injuries, $1,585 versus $171. As you can see, urgent care centers are a much more affordable option when receiving the exact same care someone could receive at a hospital. Also, for retail clinics that offer some of the same lab testing or x-rays, the cost of these services is cheaper as well.
One of the most common services of a retail clinic is prescribing medication. Many retail clinics are connected to a pharmacy or are in close proximity to one, which allows for easy access and delivery of prescription medication. Roughly 42% of prescriptions written at these retail clinics are for antibiotics. Patients who have any sort of infection can go to a clinic and quickly receive antibiotics. This is vital, as nearly 60% of all walk-in clinic visits are for upper respiratory infections. It is worth mentioning that only 14% of medications prescribed at retail clinics are for pain medications. This is shockingly low compared to the emergency department, which prescribe pain medication nearly 40% of the time and antibiotics only about 16% of the time. The reversal of what is prescribed goes to show the difference in visits to retail clinics versus the ED.
Why would it be beneficial to go to a walk-in clinic or urgent care center versus an emergency department? Based on an article published in 2013 by the Center for Studying Health System Change, known as HSC, the U.S. healthcare system struggles with an influx of patients going to the emergency departments, known as EDs, primary care physician shortages, and an increase in healthcare costs. Because of this, there has been a growth in the number of urgent care and walk-in clinics. UCCs have increased to over 9,000 locations in the U.S. These locations treat patients who are admitted for illnesses and injuries that need immediate attention but are not at the level of an emergency. Studies done by the HSC for the National Institute for Healthcare Reform say that the main reason for patients going to urgent care centers opposed to emergency departments is due to the consumer demand for convenient access care. Hospitals see UCCs as a way to gain additional patients, while health plans see these facilities as decreasing cost because they steer patients away from the costly EDs. Furthermore, health coverage expansions under national health reform might lead to difficulties for primary and emergency care, which can further develop urgent care centers. In addition, another factor that might persuade patients to go to UCC rather than an ED is the time waiting to receive care. In the picture above, the man is distraught that he will have to wait for a long time in the ED when he most likely could have gone to the UCC for a shorter waiting time. Just as there are some pros to retail clinics, there are also cons. In the picture above, it shows a physician talking to a patient and thinking, upset patient? Where's a social worker? So, the cons of these facilities. Urgent care facilities and retail clinics are known for being more convenient than emergency departments, but they have a tendency to make healthcare more complicated. Occasionally, a patient will go to a UCC or RC retail clinic to only be referred to an emergency department or hospital, which wastes time and money. This can occur because the patient was not educated on where to obtain healthcare for their illness or disease. From there, the patient who first went to the UCC could have a misdiagnosis for something that may be more serious. This issue can sometimes be resolved quicker because many urgent care centers and walk-in facilities are stemmed from the hospital. Therefore, while patient referral can increase between the retail clinic and hospital, it is not always guaranteed. Another con to retail clinics are high costs due to overutilization. On the individual patient level, the cost of UCCs may have lower cost, but the overall healthcare bill can be extremely high. The reason for this is due to the convenience of visiting these facilities. Patients visit these clinics for an illness or disease that can blow over but seems urgent to them. In a March 2016 health affairs study, researchers found that retail clinics increased the healthcare cost per patient by $14 each day. This is because of new patient visits in which the patients were not coming with a different, more expensive form of healthcare and overutilizing retail clinic services.
As Ashley mentioned, one of the greatest pros of retail clinics is the availability and access to healthcare. With many locations, it is much easier for a patient to receive treatment compared to an emergency department or even their primary physician. With much less overhead than larger emergency departments, costs per visit to a retail clinic are much lower in comparison. Additionally, a recent study estimated that approximately 27% of emergency department visits could be treated in a walk-in clinic or urgent care center. This would allow the emergency departments to focus on only the more serious, actual emergency situations. So how do we encourage people to utilize retail clinics without increasing the moral hazard and overuse of the service? Today, the vast majority of insurance policies cover retail clinics. In 2015, CVS and Walgreens both stated that over 80% of their visits are covered by an in-plan insurance policy. Continuing to compare retail clinics with emergency departments, about 26% of patients who visit retail clinics are uninsured, whereas only 17% of patients who visit the emergency departments are uninsured. This is due to its much cheaper nature, about 80% cheaper in fact. And that's not all. Retail clinics are about 30 to 40% cheaper than a similar visit to a physician's office. So insurance companies that cover retail clinics are in an interesting position because individuals who are currently uninsured may not be incentivized to purchase insurance due to the cheaper services. However, those who do will likely use it more frequently.
To conclude, we have 2 discussion questions for you guys. The first, what other conditions besides the common flu or ear infections could retail clinics treat? The second, do you believe it is beneficial to implement more retail clinics rather than relying on emergency departments? Thank you for listening.